Hello, Naomi.
Hello, hi. Can you hear
Right.
me?
Yes, very clear. Is
Uh,
my voice clear as well?
yes, loud and clear.
All right, so we're gonna get started. Hello, everyone. Good afternoon. My name is Yongxi. I'm a clinical psychologist, and we have Naomi here as a registered counselor. So today we are going to talk about common myth in mental health, right? So thank you everyone for joining us today. Among of your busy schedule during your afternoon lunch time, right? And also some of you are still on Hari Raya holiday. So thank you for joining and taking this time to learn more about mental health. So we have created a lot of polls, 4 questions in total about the most common mental health myth. And thank you very much for responding. I believe we have quite a number of people responding to our polls. So we are gonna tackle them one by one today, right?
For sure.
So we're gonna,
Yeah.
yes. So Naomi will start off with the first mental health myth.
Yeah. So the first myth is, as we all already know, is that, seeking help is a sign of weaknesses. So I think the results here, let me just pull it up. Okay, so it shows that about 12, 12 to 13% said yes, that yes, indeed, it's a sign of weakness. And a majority of them has mentioned, like about 87% of them said, like, no, it's not a sign of weakness. So yeah, maybe you can hear more in the comments as well, why or why not you think it's a sign of weakness, right? So we are going to debunk this, and yes, indeed, this is a myth. So I'm going to start with saying that yes, it's not a sign of weakness, and here's the reason why, right? So when we talk about seeking help, it's easier to put it in terms of when mental health is no different from physical health. So when you talk about um, seeking help for physical conditions, physical illness, you wouldn't call those person weak, or you wouldn't call those patients as someone who's not strong enough, right? Because it's indeed a condition. So I think what's lacking in this sort of statement is that empathy and also understanding that, mental illness are just as serious, right? Mental conditions and mental issues. So yeah, when we talk about mental issues, they exist on a spectrum. In certain conditions, it's like it's mild. It's something that you're able to take on day to day. To put it in simpler terms, think of it as like having a cold. You have a cold, and yeah, with a bit of assistance, you should be able to be back on your feet and stuff like that, right? And on other extremes, we have like more severe physical conditions like cancers and whatnot, those sort of things. So that's just try to put, if you were to think it in that sense, then it will really make a lot of sense as to why seeking help is not a sign of weakness. So I think what I would like to emphasize more also when it comes to psychological help, seeking psychological help, is that as a common misunderstanding that people would say, like, what's psychological health? It's basically just facing problems in life, and we should all be able to face it, right? I mean, it's just who doesn't have problems? Everyone has problems. We should be able to face it on our own, and seeking help, it just shows that we're not strong enough. That's the common misunderstanding. But here's the thing, seeking help means that you are recognizing the fact that, and this is very true, that it applies to all of us, myself included, everyone, is that we all have certain limitations. We all have strengths and also limitations, but recognizing the fact that we do have certain limitations, that right there is a strength actually. It's not at all a sign of weakness. It's because it means that you are introspecting, you are being more self-aware and recognizing that and coming to terms with it also, that what, yeah, here's where we are limited and we're going to need some assistance here, and it's completely okay to do that. And in fact, when it comes to psychological help, that's where, with certain situations, again, it's very complex, right, when it comes to psychological issues. So with the specific conditions, with specific situations, is where true help, you would get to either gain more insights, more ideas on how you yourself can deal with it, and even develop certain skills that may be necessary to help you get through those issues. So in that way, indeed, it is not a sign of weakness. In fact, it's a sign of strength. knowing that, you are aware of yourself, aware of where your strengths are, where your limitations are, and accepting the fact that, what, I have limitations and that's okay. I'm going to need help here and I'm going to help myself to improve. So, yeah, that's my way of debunking the first myth. So, any
Right.
questions
Yeah.
from the audience?
I
I'm not
think
able
that
to see
I
any.
like to, I don't think so far there's questions,
Mm,
but I really like how you make it into, instead of a weakness, it's a strength, because the fact that you recognize what your limitations are, and
absolutely.
that's when you can take the steps to work on it.
Yeah,
Mm.
yeah.
So yeah.
Thank you
So
for
far
that.
anyone
And yeah.
so far
Mm-hmm.
anyone has questions for your part of the myth, or maybe some counterpoints, like,
Mm. Yes, we
because we
welcome counterpoints. Definitely. It'll be an interesting conversation to have, right? Interesting discussion to have like certain counterpoints. We can definitely address them.
mm,
Yeah.
mm, mm.
And
Like
yeah, as
sometimes,
I was,
like, some
sorry, go
people
ahead.
would say sometimes some people would say like, oh, it's really because you are too weak in your determinations, or you're not
Yeah.
putting enough effort,
Mm,
because life is hard, everyone has difficulties, why can't you just pick yourself up, kind of
absolutely.
thing, right?
Absolutely. Yeah,
Mm-hmm.
yeah. Those are the common things that we hear.
Mm-hmm.
And that's the thing, actually, because we are oftentimes the narrative is that, this is just everyone's problem. Like everyone has problems. You should be able to learn to deal with it. But what we don't recognize is that there's just so many complexities sometimes that it's completely okay to, needing some assistance. Like I said, right, physical health wise, if you need some assistance when you're having cold or fever, that doesn't make us weak. Similarly, when you're having some kind of mental struggles, doesn't make you weak to, just seek help at times. In fact, it helps us to get back on our feet. And another main thing is that it's also a sign of courage, being able to recognize that, what, here's where I'm lacking, and I'm gonna actually, we all have like some kind of, what's the word? Maybe some kind of ego within us also, like, what, I got this, I have to do this on my own, that kind of thing.
Yeah,
But
I
it
must
takes a
be
great deal of,
strong.
absolutely, yeah, so it takes a great deal of courage to tell ourselves otherwise, that, what, hey, we would have to seek help here. So that's a sign of courage right there. Yeah.
Mm-hmm. It's kind of redefining how we see courage and strength as well. When the usual way of looking at strength is you must brace through all of the things without showing any sign of, oh, I feel tired, I feel weak, all these like unnecessary things. But when you say it, like acknowledging that weakness, vulnerable parts
Mm,
we have, it's also a way
yeah.
of showing strength as well.
Mm. Yeah,
Mm.
definitely,
Yep.
definitely. And you put it so well, so I completely agree on that part.
Mm.
So I suppose there's no counter thoughts so far?
Because so far the people who responded no, that means like disagreeing with that myth is quite high, right?
Yeah,
So
yeah.
it would say that everyone has quite good awareness on mental health.
That's fantastic to hear. Absolutely. And yeah, glad to know that we're mostly on the same page. Yep.
Yeah,
Mm-hmm.
yeah, it's good.
Right.
All right, then we can move on to our next point.
For sure. Yeah.
Right, so the second point is there is no such thing as mental illness. So I'm not sure if anyone have responded to this question, this myth. So people have it by chance, is it? So in the poll, we got like 20% of people responding yes,
Mm-hmm.
and 80% of the respondents said no, which is also a very good sign that like the majority of the us agreed that this myth lah is it doesn't disagree with this myth basically.
Yep.
So I think a lot of times like we have heard like especially maybe the family members of the client that they will
Mm.
say, maybe this client is not strong enough, or since young this client is a bit more weak, a bit more mellow, which makes them to have this perception like it's not because they have mental illness, it's because
Mm-mm.
they choose to be this way or they are lazy. So but the thing is mental illness is not really a choice. I don't think anyone would choose to fall sick lah, unless you benefit from sickness, but most of us won't do that. We won't want to fall sick, we won't want to have fever, we won't want to have COVID, I guess, right? So
Of course.
same thing goes to mental illness. We don't really want to fall sick mentally as well. I believe all of the clients that I see, most of them, they really try hard to work on whatever that they are facing. They really show the determination, the efforts to work against this mental illness. But a lot of times, because of the environmental factors, for example, the school system or the culture, the stress from different places, makes it harder for them to feel better. The
Mm-mm.
external triggers is there also, and
Mm-mm.
also another part is the personality or the temperament, which is um something that comes from young. Like some, it's like all of us have different kind of personalities since young. Some of us are easily become moody. Some of us can actually is very calm all the time, like very calm since young, that kind of thing. So everyone has different temperament that can contribute to our mental
Yep.
illness situation or mental health situation lah, basically. So there are a lot of factors come into place, which explains why it's unlikely that mental illness is caused by a choice, right? I saw some question here. Can I just
Yeah,
yeah, so
for sure.
there's a person said craziness can be cured now. Yeah. Mental illness is important to be addressed. Sometimes our older people don't get it. As they say, those days we handle more problem easily and we have no depression. So yes, I have heard of this before. Like, those people from different generations, they are not so aware of mental health
Mm-hmm.
issues, and they just brush it off, or they just think like, oh, because we breeze through it, we are able to just tahan, right? So
Mm-mm.
this era, maybe all of us are more soft or whatever, like strawberries or kind of like thing, right? I don't know if you've heard of it. Mm.
Mm-hmm.
So, in my perception, it's also related to the culture and awareness. So in the previous generation, because different generation they have different culture values, in that time they are not so aware of mental illness or not so acknowledging this part. So even if there is, for example, depression, for example, developmental delay,
Mm-hmm.
autism, all kinds of mental illness and neurodevelopmental issues, they kind of just allow this person to deal with it themselves. So they
Yeah,
don't report it, they don't talk about it, they have no awareness. So those people who can tahan it, they will say like, oh, we don't really have problems. But what about those people who actually have problems? They just don't say it. Yeah, that's what
absolutely.
my perception lah. It's just the statistics
Mm-mm-mm.
is not there. How about you, Naomi?
Absolutely. Yeah. Yeah, I
Mm.
like your take on that. And yes, that's why it gets the present struggles get invalidated. This it's because of this exact reasons. And in my opinion, I think it's a matter of different forms of struggle. The struggle has always been there, be it any era, right? The
Mm-mm.
struggles have been there. Maybe in the olden days, the struggle or the stress has been more on the physical aspect of it. Those days, the way I see it, might have been that those days was more of like hard work. That was that. It was more on like the
Labor.
stress was more on the physical aspects of people, and of course that does take a toll on mental health as well. But then, of course, like you said, the awareness and whatnot, it's not there. There isn't much discussion on it, the topic on it, and resources wise, there was these were the things that we were lacking back then, which is why it was so easy to dismiss and especially when it comes to mental health, it's easier to dismiss or disregard because it's something that's abstract, you can't see.
Mm.
When it's physical, you can actually see it, right? So that's I would say one of the issues. So compared to these present days, I would say the struggle or the stress is more on the mental aspect of it. And we've evolved over the years, we've changed with developments, with technologies and whatnot. The way we work, our work culture and everything has changed tremendously, I would say, which is why it it caused like a shift in the way we work, the way we function, and everything has changed. So definitely it is I would say it's an unfair comparison to make. to, with our
Mm,
present struggles. It's an unfair comparison to make with, the olden days where things were definitely way different back then. Take financial struggles, for example, the cost back then is definitely not the same as today, the cost of living and stuff like that. That itself is one of the main struggles that people are facing right now. And that's just one factor that I'm naming. Let's look at how many issues we are facing with. And all those issues take a toll on our psychological health for sure. So yeah, definitely it's invalidating in a way to make such comparisons. Yeah. So
I
that's my take. Yeah.
So what you're saying is there is a lot of changes in terms of culture, in terms of environmental stresses,
Mm-hmm.
working environment. Because of these different factors in play, it's very difficult for us to
Yeah.
compare that different situations, and how much more awareness we have. Actually, it helps us to recognize what we are struggling with. And for example, you know that today you're more stressed out than usual. So
Yeah.
then you can do something to regulate back, instead of last time maybe you just ignore it instead of avoiding it. Then
Absolutely.
how helpful is it? Not too sure about that
Mm-hmm.
lah. Usually we won't recommend that as well to avoid.
Mm-hmm.
I see a person commenting doctors suffering from mental illnesses. Nani, would you like to respond to it?
Yeah, I mean, it happens to the best of us. Similarly, like I said,
Mm.
I would just like to make this connection with physical illness, because just to make it understandable that it's really not very different. They are all conditions where it happens to the best of us. Anyone can suffer from it. So
Yeah,
yeah,
for
of course,
example,
doctors are no exception. Psychologists are no exception. Exception
yeah,
to that. Yeah,
for
absolutely.
example, right, today you fell down physically, like you have a wound in your leg, and then
Yeah,
somebody just tell you, you should just ignore it, like brush it off. No big deal, right? So you won't give yourself the normal treatment. You will kind of desanitize or put the ointment onto your wound.
yeah,
So it's asking you to just ignore your wound lah. But this wound is mental. It becomes a mental. Then people can ignore it, like what you
yeah,
said.
yeah. We call it when it comes to psychological, I suppose we can call it emotional wound. Yeah.
Emotional wound. Yes, yes,
Yeah.
yes.
So as you were talking, it got me reminded of the part where we I believe, I don't know, maybe you can share as well. Maybe
Mm,
us as psychologists also would have been hit with this kind of questions, like, how come you're not handling this well? You are a psychologist. I thought you should be able to handle this well. Or yeah, those kind of questions, we get hit by those questions as
yes,
well. But again, so same thing, right? Doctors can get cold. Doctors can have illnesses as well. Similarly, psychologists, yes, we might have better knowledge and skills on how to handle or how to navigate through situations, but we are no exception to those. We are all as prone to mental health issues as
yeah,
anyone.
yeah.
Yeah,
And all these life struggles,
of course,
challenges, we're not immune to them lah.
definitely, definitely.
Yeah. And I like to think of this way lah. Like we have the skills to regulate, but sometimes it's still like it's different from how you, for example, you treat yourself compared to you talk to another person about
Of
this,
course.
whatever that we are struggling. It's a different thing, because whatever that we talk, when we express it out, we are processing it. We are really getting that support as well. It's a very different thing as well lah. So we all
Hmm.
need that social support.
Definitely, definitely.
Mm-mm.
It sure does.
Yeah.
A lot of factors do play a part in, what helps us, or yeah, I would say what makes or breaks us. So definitely, a lot of factors do play a part in that aspect
Mm.
for sure.
Yeah.
Yeah, yeah. So,
All right. No more questions.
yeah, I suppose there isn't any question. So yeah, we'll take it as no counter thought to that. Mm-hmm. Oh
That's
yeah,
right. Yeah.
yes. Should we be honest with our psychiatrists? What do you think? Absolutely. I would say yes, do be honest with psychiatrists. And okay, maybe I have a follow-up question to that. Like, what makes you think, or what makes you question that, you should keep something from your psychiatrist? What makes you think like, you shouldn't say something? Let's talk about that. If you have thoughts, feel free to type in the comment, and we'll talk more about that as well. But yeah, before we go into that, definitely be honest with your psychiatrist, so that not just psychiatrists, psychologists, there's a difference there, right? So knowing the full picture is absolutely necessary for us to really understand the problems, because like I said, psychological issues are very complex. So it's gonna take us having sufficient information, and that's where honesty is gonna help. Yeah.
And I think sometimes people will feel reserved or difficult to voice out honestly because we're not used to sharing it to another person, and we will feel scared about sharing, or what will this person think of me. But in our field, in psychiatrists, psychologists, counselors, we are all trained to not just judge you based on what our bias thinking, but we are look at it to know how to help you better, how to understand you better. Yeah. So
Yeah.
I can
Yeah.
see
So
that
you're
you
spot on about that. Yeah.
mm, mm,
So I think
you
inferiority is what
mm,
keeps people
mm,
from being honest. So you're spot on about
mm,
that.
mm,
Yeah. Sorry,
mm.
I'll let you finish.
Yeah. I mean, whatever that like pulls you back lah, whatever feelings, inferior, scared. So kind of understand that we don't sit here to judge you, but to help you to find ways so that whatever you share honestly, it could help us better understand of what you're going through. We have ways to conceptualize, to understand lah, not just cherry picking information. Mm, mm,
Absolutely, absolutely. Yeah, and yeah, like you said, there's definitely a lot of barriers, and we as psychologists, we understand that as well. It's just that, making it, we definitely from our side would try our best to make it a point to make you feel safe enough, in the first place, to be able to open up. Of course, take all the time you need, and that's where definitely psychologists will be, therapists will be understanding if you need more time. That's completely okay as well. There's no need to push yourself. It's just that, recognizing the fact that yes, it's difficult to be honest at the moment. Maybe there's a lot of barriers, and maybe those barriers are the ones that you can talk about even. So it's those kind of honesty as well. Like, even though you don't know what's the barrier right away, but being honest with the fact that you do have certain barriers. Yeah,
yeah,
that's the way to
the
go about it, I would
acknowledging
say.
the
Exactly.
acknowledging part,
Yeah.
very very
Hmm.
important as well. All
Yeah.
right, I
Yeah.
think it's time for us to move on to our next myth.
For sure. Yeah. So the next myth would be that your mental issues are due to your lack of faith. Yeah.
Hmm,
I think this is something that's very popular and
very
kind of
popular.
similar, for sure, and kind of similar to one of the comments that we received earlier about how, like, sometimes older people don't get it because they think, like, those days they were able to handle things more. Maybe they were closer to faith in some ways, those sort of things. And I think the most common source of like this sort of statements is also from like the older generation, maybe, or even if it's not older generation, it's just like from parents, or like, family and friends, where they're like, pray more, or like, have more hope. That's where you'll be able to handle situations better and stuff like that. So yes, this is a myth, 100%. And I think what respondents have mentioned is that yes, definitely more on the majority side, they said like, no, it's not true. So yes, absolutely. And I'm glad more people agree with this, that this is indeed a myth, you know, and we'll definitely talk about why this statement is problematic. So first of all, like what Yongsin said, right? Like what you said, there's so many factors that contribute. You've outlined all those things that actually contribute to mental issues. It can be just so many things, environmental wise, nature wise. It's just so many things. When there could be so many reasons that contribute to your mental health. To pinpoint faith, it could be something that is very, um, I would say it would be invalidating one's experiences, one's painful experience. When we are all, like I said, prone to having mental issues equally as anyone. right?
Mhm.
Also, yes, definitely, I think I do see the point in why people think that having faith is one of the reasons why, I mean, sorry, not having strong faith is one of the reasons why people will be feeling this way. But I would say that yes, faith could be a good protective factor. Protective factor meaning that, meaning to say that it's a one of the things that can help us feel hopeful in certain difficult situations. Absolutely, it's one of the great factors, but it can't be the only factor that makes us better, in makes us psychologically better. Yeah, let's put it that way. Um, Also, when it comes to mental health, there's, like you said, there's so many factors that's affecting, right? And one of the things, like, we would like to, it would be easier to help people understand is that let's consider the factor of circumstances in life. And there could be so many circumstances like tragedies, losing a loved one, and people grief happens to almost, it can happen to anyone, and no one can, in a way, escape from it, right? It can just happen, right? So those kind of situations, those kind of circumstances, so how are we going to go up to someone in those circumstances and say that, you lack faith, which is why you're not taking this death very well? Just imagine how mean that can sound, right? So, which is why this statement is indeed very problematic. It's not a mere myth, it's also very problematic actually to say those kind of things. Because yeah, these kind of circumstances happen to anyone, and we wouldn't want to go around and invalidating other people's experiences. And maybe you can come from a good place, from good intention, saying that, hey, having faith helps. That's different from saying that, you know,
You're
you don't
not
have enough faith.
not faithful.
Yeah, so
Yeah.
it's about the way you word it. And yes,
Mm.
you can come from good intentions, from good place, but it's about how you put it. So do be more mindful of how you say certain things. Yeah.
Yes, I guess when they say it this way, sometimes, right,
Mm,
when you say
mm-mm.
it's mostly coming from our parents or our family members,
Yeah.
maybe their intention was like they wanted to cheer someone up. They want to say, hey,
Yes.
you should just find an alternative to cope with your stresses. But when it comes out this way, like, oh, because you're not faithful enough, because you haven't done enough prayers, it could
Mm,
come off as judgmental. And of course, the intention was good. Maybe the way of delivering as well could be adjusted lah, instead of using this way. And I like how you say
100%.
that faith itself is a protective factor. That actually, it's not that it's not good, but we don't say it this way, like, oh, you must pray enough, because different people have a different
Yep.
way of connecting to what they believe in. Doesn't have to be this way.
Yes.
Mm.
Yes. 100%. And
There's a question
yeah,
here. Nick.
yes. Let's
Yeah.
try addressing them.
Mm.
Okay. Yeah, there were like a few comments here and
Yeah,
there.
childhood
Like, I think,
traumas.
yeah, I think those were the factors that they were outlining. Definitely, it's a taboo topic when it comes to, mental health, what people are struggling with. And yeah, childhood traumas and bullying, stress, all those are factors that we often overlook, and we often invalidate in saying that, you know what, you're not strong enough. Your faith is not strong enough, those kind of things. Yeah. I just have to one more point to add on about, like, why this is a myth and why it's problematic. Is again, I would like to emphasize on how this is not different from physical condition. So, take people with cancer diagnosis, for example. You can't go up to them and say that, you know what, your faith isn't strong enough, which is why you got cancer. Just imagine how bizarre that is, right? So yeah,
Mm.
it would be unfair to pinpoint one's faith as the reason why they are being in that condition, be it physical or mental condition, right? It's something that is very unfair thing to do, I would say. For all we know, one can have strongest faith, and saying these kind of things, it kind of like would make them question, and I would say question their own faith, and I would say that's the last thing they would want for someone
Yeah.
who's already in a situation where they would have to deal with their conditions. It's a lot. It's a lot.
Mm.
So,
Mm.
which is why these statements are problematic, and it could really be one of the reasons or even causes of why there are, like, or there continues to be stigma and also
Mm.
around surrounding mental health, and that's what we are trying to break off from. Actually, we are trying to break free from this sort of stigma and the kind of, and let's not forget how having this kind of mental struggles usually comes with shame, comes with self-blame and things like that. So it's not helpful at all when we tend to point out these factors as one of the reasons. Yeah. So yeah, which is why it's so important, the kind of things that we say. And what we're trying to do through this live session is to create that awareness. And for those who are hearing today, do share this around, and also keep in mind to be more mindful of the things that we say when it comes to
Mm.
this. So that's the main point that I wanted to add on to debunk this particular myth. Yeah.
Mm. So I like how you're using that cancer to explain how we talk to a person who has mental illness or mental issues, because if they have cancer and then you tell them it's because you are not faithful enough, that could come off as how are they related to each other kind of thing, right? Yeah.
Mm-hmm.
So
Mm-hmm.
there is one question here.
Yes.
If I have mental illness, saya layak bekerja tak? Means like,
Mm.
am I
Qualified to work.
qualified? Would you want to address a little bit just briefly, even though it's not really related to myth lah? I guess.
Mm-mm-mm.
Hmm.
But I think it could be related to our next point. So yeah.
Oh,
So now,
yeah.
what do you think? Yeah.
Yeah,
So
maybe
yes,
move on to the next point and we'll try to address this question.
for sure, we can do it
Yeah.
simultaneously. Yeah.
Yeah, so the next myth is I feel very sad, so I have depression. I can see a bit more people responding yes to these questions like compared to the other myth. About 25% of people responding yes, and then 74 responding no. So a very interesting way of looking at it lah. When people tend to say, oh, I feel sad, or these few days I feel sad, so they start to jump to the diagnosis like, oh, I have depression, uh, or like I have a very low time, then it becomes a diagnosis for themselves. And how this relate to this is a thing about how we differentiate like between sadness or within like a normal range of sadness, and also the range where it's impairing, affecting your functioning. It affects the way you can work around your tasks. It affects your relationships with your family members, with your friends, and it will also affect how you see yourself. It will make you feel like a long-term kind of depression, a long-term severity, like it makes you feel very low all the time instead of just a temporary moment. So, for example, let's put the frequency lah. So for not like a sadness in general, we will feel sadness and it's okay. The sadness could last 1-2 days, and after that you can rebound quite quickly. But in terms of depression, it's quite a long-term thing. It can happen every day, almost all the time, and it can happen longer than 2 weeks. So that happens, that can become a bit more severe and can be considered as a depression kind of thing lah, right? So to look at whether you are able to work or not, are you fit for working? That depends on whether you can cope. So if let's say today you feel low, you really feel not really motivated, but you can still pull yourself up and take the necessary tasks, take care of yourself, eat your lunch, take bath, all these things, that means you are able to still cope with it despite that feelings. So what we are saying is you have mental or you don't feel good, it doesn't mean you cannot do anything lah. It doesn't correlate with it. Also, it depends how intense you feel, how much you have tried, but still can you try to work towards your goals? Can you still take your daily tasks? A lot of times, people with mild depression, they can still work on different things. Like, for example, they can still go to work, even though maybe internally they feel like very dreadful and all these things. So it really depends on the severity,
Mm-mm.
right?
Mm-mm.
I can see some questions coming in.
Yes.
Try
Yes.
to address. Let me see if I miss out anything. So,
Mm.
I think someone said about what diagnosing yourself. Yeah, that's good. That's good.
Yeah.
There's a
I
story here.
think before that, there's yes, absolutely.
Is
So,
it?
mm,
My friend recently diagnosed situational
depression.
depression due to marriage. 3 months tells me unable to face her husband. It's like a trauma, but he wasn't physically abusive.
Mm,
So it's a friend's situation like being diagnosed with depression because of the marriage conflict, right? And it
yeah,
seems like
yeah,
this marriage is quite conflictual until causing her to have this depression, and her family is forcing her to move in back
back.
with him. Back with him.
Yeah,
Okay, right. So what can you do to motivate her as a friend? So
sounds like a
that's
thoughtful friend.
yeah, very thoughtful friend, and to have this intention to help your friend is very very good. I
Definitely.
would say really, I think your friend will be really appreciate that lah. So to help your friend in this situation, firstly is to acknowledge that to motivate her, it could be there will be difficulties, but there are some ways you can help to support her lah. For example, giving her a very good listening ear means whatever that she tell you about or she's trying to confide, allow her to share and not giving her too much judgments, too much advice. For example, you tell her, oh, you shouldn't think this way. Oh, you should go out and get help already. It's because your husband is too bad, blah, blah, blah. So a lot of judgments. So we try to keep
Refrain
that
from that.
within ourselves and allow her to give her that space to share.
Yeah,
That's the
yeah.
first. Now, would you like to share any extra points for this? How to support?
Definitely. Yeah, definitely. And I would agree with the part, offering listening ears, most importantly, non-judgmental listening ears, right? Giving this, I think the safe space alone is more than enough of a help that you can offer actually, because that's what people often lack, right? And sometimes I do understand that when we are in a position of a friend or a loved one, we feel pressured in a way that, you want to be out there and help for them and be for them, actively doing something, actively offering solutions. But maybe in their circumstances, there isn't much scope for an active solution. Sometimes situations are such that you are not able to do that, and that's completely fine. And just being a listening ear is good enough of a help. And sometimes we, because of that pressure of like you as a friend, you feel like, or as a loved one, you feel like you want to be able to take away their pain, you want to be able to solve their problems for them. But that's why we would want to try to take a step back and understand that maybe it's not, firstly it's not in our control also. When it comes to like marriage problem of others, it's coming from a big, it's coming from an external source that's way out of reach, that's way out of your control. So what can you really do? Truth is that nothing much, right? But
Mm,
maybe what you can do is offering support on like any resources that you can get, or like any resources to help her seek help to, I don't know if what she's looking for is to get out of that marriage or get out of that household. So looking up for resources, looking up for places that she could seek help from, those are the ways you can help. And
mm,
absolutely, aside from offering listening ears, but maybe we can refrain from like giving out advices on specific things that they should be doing. Sometimes we can it's a bigger thing to do, is understanding that sometimes it's not our place to give out advices also, because at the end of the day it's someone's personal life, and it's completely
mm.
okay that we take the bigger route and tell ourselves like, you know what, it's not our place to do that. But what we're going to do is just offering listening ears. Trust me, it's more than enough. It can feel like it's not enough. Sometimes it feels like you're not doing much, but it's enough for sure. And
Yes.
sometimes what one person needs is just a space, an outlet, basically, an outlet to be heard, to be understood. So just make that the main goal or focus of that conversation. That is to ensure that the other person, whatever that they're sharing, make them feel like they're understood and they're heard. So it's gonna take really listening, active listening, like you said, right? making sure you understand the problem. So it takes asking a few questions, asking for clarification, or is this what exactly you're struggling with, to really understand their struggle. That is more than enough, I would say.
Mm.
Yeah.
Right. So offer a listening ear and understand that what you are doing is enough.
Mm-hmm.
It's really good enough as a friend, right?
Mm-hmm.
And we have more questions coming in.
Yes.
Uh, right. So the
Mm.
next question would be, uh,
Specific
have you read?
to PTSD.
Yeah,
Yeah.
specific to PTSD, and can't handle what to do, not sure what to do, and CBT doesn't seem to work. PTSD is quite a complex mental illness,
Yes.
and it really depends on what's the triggering factors.
Mm-mm.
And she elaborated, I can't control my trigger and always let it go on my husband. I didn't mean to. That means releasing your emotion to your partner lah, right?
Mm-mm.
Mm-mm-mm. Uh, I'm not sure if we have enough space to discuss this full in the full spectrum.
Yes.
But the main question is what can you do lah, right? Not too sure how to handle and turning to your partner for validation. This can come quite complex, and it depends on what triggers and what's your thought process.
Mm.
And you said CBT doesn't work. Could it be? There's a lot of reasons why it doesn't work. Also, if you're working with a therapist, it could help you to kind of look into more spectrum, understanding more in details lah. I'm not sure, Nani, would you like to add something into this
Yeah.
question?
Yeah.
Mm.
100%. And I would see, um, maybe one of the reasons I could think of looking at how, why you would think that CBT may not work in this particular situation is that, the trigger is very much still there. And, when it comes to PTSD, right, it flares up your trauma response, even in the absence of a trigger, absence of the thing that triggers you. But it could be one of the smallest things that reminds you of that past experience that can flare up your physical symptoms. So addressing thoughts is a harder route to take. Actually, you're going straight into your thoughts. Thoughts is always one of the hardest things to deal with first. So
Mm.
maybe something might have been overlooked there. And what I could think of is that the addressing the physical aspects, the physical symptoms that we could be experiencing. Maybe that's something that was overlooked. So I think the main thing when it comes to PTSD is that first thing is to get your body to get used to being in a calmer state of mind and body. Yeah, in a calm body and mind,
Mm.
actually. So
Mm.
it's
That's,
gonna take getting used to that first, and then
mm.
getting and being calm in a phase of trigger. So introducing those triggers step by step. And that's just how that's the overview of how working with PTSD looks like. So maybe there's a bit of you know an overlook that happened over there. Maybe that's what happened, where jumping straight into CBT makes CBT is wonderful to work with. It's just that in this particular situation, there are things that you would need to address first before you get there. So yeah,
Mm.
and I would say definitely it's gonna take, and PTSD is such a complex issue. It's definitely something to work with a therapist, and
Yeah.
in a safe space, it's so important as well. It flares up your trigger response, your trauma response, right? So you would need to it's gonna take telling yourself a lot that you know you're safe now, you're okay, you're fine. And sometimes it's hard to do that when you're on your own. It's going to take an additional voice, a reliable voice,
Mm.
a
Mm.
therapist voice
That
to tell yourself that
safety
you're fine.
feeling, right? The most
Absolutely.
important part is feeling safe. But in
Yeah.
PTSD, it's very difficult to feel safe even when
Mm.
you're alone, because too many thoughts and images keeps
Yes.
on triggering. Mm.
Yeah. Yeah.
Right.
And I would definitely have to recognize that you're able to be aware of your response. This person, whoever commented earlier, saying that you tend to let it go on your loved one, and you don't mean to do that. So that, first of all, kudos to having that realization. It always starts with realization, and we often, you know, not give ourselves enough credit for having the realization in the first place, because it's so easy to not have that realization and just pinpoint your issue, which is like, oh, I have PTSD, which is why I reacted this way. But you're not doing that. You are recognizing the fact that, although I have this, I am doing this to my loved one, and this is not fine. I would want to change that, and that's what you're doing. So once you have that sort of realization, it's about, each time you do similar things, you'd want to catch yourself and tell yourself, you know what, I'm doing this again. Let's try not to do that. So definitely, work with the therapist to, get past those triggers. And yeah, it's going to take exposing yourself little by little to those triggers and learning how to manage those triggers better. And that's where changes can happen. And that's where you would find yourself eventually having better emotional response to triggers and whatnot. Yeah. So that's my take on that. Anything to add on?
I really like how you acknowledge that part as well. When to be aware of what's going on within yourself is already a very good start. To have the
Absolutely.
courage to acknowledge it as well. A lot of times people will just brush it off or act upon the urges or the fears and not aware of what's going on. So really, really kudos to that lah.
Yeah.
Right? We have more questions coming in. Shall we continue our appointments with our psychologists? There's this question. So this question asking, shall we continue our appointments with our psychologist? What do you think? It depends, right? About whether it's helpful to you. And it's very common that sometimes we meet a psychologist and then you don't feel like you're connecting well, or you don't feel so comfortable. It's okay to kind of change your therapist sometimes to see which therapist fits your personality better, all these factors. But if you think that, hey, I need this person to help me out, to hold this space for me to explore this past events, past traumas, or work on certain things to improve myself, definitely I think a therapist could help you to hold that space and work with you together lah. Okay.
Yeah.
Then the next question is, saya pernah okay, I might need your help. Now, can you see the question banks?
I'm not able to actually.
Oh,
So let me
okay.
see. Oh, okay,
Let,
okay, okay. All
yeah.
right. Is it the one saya pernah dianiaya disebabkan saya ada mental illness? Mereka cakap saya tak layak bekerja sebab gitu. Is that the one you're
Yes,
talking about?
yes. Could you kind of make it into shorten it a bit?
Okay, let me see. Okay. So what to use, put my language skills to use. Okay. Okay, so basically, it seems like this person was in a way discriminated at work due to their mental health struggles. Yeah, and they were told that they don't qualify to work. First of all, sorry to hear that, and this is what we are trying to change. Actually, this kind of discrimination, and this is what we are trying to do, is to create awareness that what, these are actual struggles, and just because you're having a bit of struggle doesn't mean that you are not capable or you're not qualified to work. Again, it all depends on the severity of the diagnosis. So it's going to take understanding. Yes, mental health, certain mental illness on severe levels, it can affect your daily functioning, but it doesn't mean that it takes away your capability to do so, right? With help, with psychological help, with psychiatric help, with medications, and with also, through psychological help, you would learn to develop certain skills to help you function better. So it is possible for you to, definitely be able to work and
Yes, a lot of
doesn't
times.
take away your capabilities for sure. Sorry, you saying?
A lot of times, people with mental health difficulties or mental illness, they can still function. They can still go to work with the treatment together. They can still work on whatever they want to do lah. And also, it seems like this company is kind of discriminating, right? Because of the thing that she has mental illness, so she is not allowed to work. In this case, sometimes if let's say environmentally, some people, they don't really understand how your condition is, maybe getting a diagnosis or getting a assessment lah from a report from the psychologist or a report from a psychiatrist that can verify for you how's your functioning level, whether you are fit for working or not. That is to allow this whatever environmental factors, your boss, your employers, to understand clearly lah. Because sometimes this stigma is very hard to break also. So it's really sorry to hear that lah, how you are facing this stigma.
Yeah, yeah, definitely. Yeah, it's an unfortunate thing that we are continuing to face this sort of issues, which is what we are hoping to change with more such conversations. We're hoping to change. And whoever's here today, please do make it a point to share this kind of awareness around to your start with your closest circle, I would say. Start there, start small, do share it around, make it a point to talk about this more so that more people understand that this is indeed an actual struggle. Just because it's abstract, it's something that you don't see, doesn't mean that we can invalidate it and it doesn't exist, just because you can't see it, right? Yeah. With again and again, I'm trying to make this connection with physical illness. When you look at physical illness, it can sometimes, how sometimes it can lead to death, right? Certain physical conditions, it can lead to that. And we've always seen, and from time to time we keep hearing about suicide when it comes to depression, and those sort of like extreme level of mental struggles can lead to that point. And how, like, to put it in simpler terms, like how the last stage of cancer is where it ends up in death, and the last stage of depression is where it ends up in suicide. That's the last stage already. It's where it gets extremely difficult for the person, that they're pushed to that extent. And yes, this is a much more complex topic to touch on, actually, to talk about suicide, and how it's something not to again, not to be disregarded, or something not to be something that we shouldn't call it as like mere lack of faith or mere lack of hope and stuff like that. So yeah, it's really important. So firstly, understanding that what I think the whole point of today's topic is the myths that we've outlined. We are trying to say that these statements are problematic and these statements are not helpful for anyone. So going forward, let's be more mindful of that. Let's be more mindful of the kind of things we say to ourselves, to others, to our loved ones especially, and try to be more understanding by, just understanding, just being better listeners, just asking more questions to really understand what exactly they're going through. And yes, most importantly, preventing from like self-diagnosis is also important. I suppose there's a lot of information out there these days, which is great. Information is what's going to help create awareness, right? But do check the resources. And also, diagnosis, one of the most reliable ways to get diagnosis is through proper assessments, and definitely with people who are qualified to do that, who are qualified to give you a diagnosis and tell that, what, yes, this is indeed a struggle. So we can always, like, list down the criteria of certain mental health conditions. So it's very easy to just look at those criteria and relate to them, and like you would notice how many boxes you check, and then from there you can easily have, like, I don't know, 4 to 5 diagnoses from there if you were to do that. So that's what we are not going to do. We are going to be more mindful, because when it comes to diagnosis, it's not just about looking at those criteria. It takes thorough analysis to look at the whole background of
observation.
If you want to,
right?
like,
It's not just criteria.
Yes, definitely.
Yeah, and there's one more person. She's talking about, usually doctors will advise not to expose your diagnosis. This question is, I mean, some doctors, maybe due to fear that the patient might be facing stigmas when they review their diagnosis. Yes, it could happen when your employers are not very understanding, or when your family members don't believe in mental health issues, then it could become this way. But I guess it's looking at the situation, whether when you review certain things about yourself, does it help you as well? For example, if today you really have a headache and you cannot go to work, and then it could be a valid reason. So it really have to depends on what situation lah. Oh, there's one more question about how severe is NPD, narcissistic disorder. I think this could be out of our scope because today we're talking about debunking myth of mental health. How
Mm-hmm.
severe is it? Do you think we have time for answering this question, or maybe we'll leave it to our next
Very
session?
briefly,
Mm.
what I can say is that, it's a personality disorder, right? So when it comes to personality disorder, it's good to look at how, when we talk about severity, is that how much the person or the people around them are affected by it. So it varies. It really does vary, and no two people are alike. It's subjective in that sense. So yes, it can get pretty severe, where the person themselves or the person, I think with narcissistic, it's more of like people around them could be heavily affected by that. And maybe that can affect relationships and therefore affect the person themselves who's having that
Mm.
disorder. So I hope that very quickly answer your question. So if
Yeah.
you're going to go too deep into that, we don't have enough time for that today. But yeah, definitely next
Mm.
time, yeah, for sure, we'll address that more in more detail. Yeah, and
Yes.
that's another question on what
What happens if
happens if your
your
doctor
doctor?
triggered you.
Yes. Right.
Hmm.
So if your doctor triggered you, that depends on what happened. Uh, are you okay to kind of is a psychiatrist or is just a medical doctor? Because if let's say is a therapist that triggered you, then it's good for you to address it in the session. Talk to your therapist about how this word or how your therapist's
Yeah.
behavior is triggering you, because that could actually help you to work on whatever that's triggering you in the session.
Yeah.
So that part, if you're working with a therapist, that would be good lah. But if it's a doctor, general doctor, maybe that is very difficult for you to talk to the doctor about it.
Yeah.
Then
It's a medical
maybe
doctor.
you might want to talk to your therapist or talk to someone to really reflect on, oh, what happened, how this person is triggering me, and whether it's the actual issue that, oh, this doctor is very rude, this doctor is very judgmental, or
Mm,
actually it comes from our own perception, like uh, by just looking, maybe the doctor just didn't look at you, then we interpret it as something else, then we will feel triggered. So it really depends that on the situation and on our thought process,
mm-hmm.
right? Mm. So now we have about maybe 5 more minutes left, 3 to 5 minutes. Would you want
Yeah.
to summarize and also bring in your extra points? I think we have some little tips for everyone, right?
Yes, very quickly, right? So with everything that's being said today, it doesn't mean that, yes, mental health illnesses are real, they are actual struggles, but it doesn't mean that, this is something that, once you have it, something that like, you're doomed. No, it's not, nothing like that. Definitely, a lot of factors do weigh in, like as you have pointed out. So yeah, considering that how there's so many factors that affect one's mental health, we can also it also gives us hope that yes, these factors is something that we can look into to help us reduce the risk factors. So it takes having a more supportive community, and this is what we are trying to do as well, trying to have more such conversations and do our best to increase awareness so that we as a community, we grow towards becoming community that is educated on mental health issues and mental health struggles, and so that once within a community there's someone who is actually struggling, we know how to offer the kind of support system. So support system does play a huge part in reducing these factors, in reducing, and it also helps in creating an environment where it nourishes or it fosters mental health. Yeah, so I would say looking into those sort of things, and aside from supporting, and we can definitely look into the environmental aspects of our situations as well. So looking at how um we are probably at a age where we are like younger adults. So as we look into growing towards becoming parents, for example, that's where we can look into how we as parents, or we as like the older generation now, be the change, the point of change to the younger generations, to our childrens and whatnot, to be able to, provide that support for children, and, ensure that they grow up in healthier environment and in a healthier state of mind and things like that. So those are the ways we can actually try to reduce risk factors. So we can definitely look into those environmental aspects of it and work towards creating a space where there's more such conversations where people feel safe enough, and with hopefully over time stigmas have reduced, and this is where it would, create a space for um for a, I'm not, the word is not coming to me right now, but yeah, for a place where everyone is able to talk about their struggles without feeling judged or, misunderstood.
Being
Yeah,
accepted in general.
accepted.
I think how we break this stigma, right? Also, we learn to accept what we have before we
Yeah,
spread. We try to advocate like, okay, it's okay to feel these things. Firstly, we accept it, then we can
yeah,
share this with people around us as well. I think it helps ourselves and others.
definitely. Yes, yes, definitely. So yeah, that's it from my side, I would say. Those are, like, after debunking all those myths, acknowledging the reality of mental health, it doesn't take away the hope that, there's still hope for sure, that with sufficient help, and we are growing towards that, psychological help are definitely there. It's about, making these resources more and more accessible, and with this, and over time, definitely, we can create a better future for a generation that is more aware of mental health struggles, and also a place where it becomes acceptable for us to talk about it more and to address those issues openly. Yeah.
Wow, thank you for
Mm-hmm.
everyone joining us, asking so many wonderful questions. Sorry if we
Yes.
can't really address all of the questions lah,
Mm-hmm.
due to the limited time. Feel free to join us on our next live talk. I think it will be coming soon next week as well, right? And
Yes.
also, thank you so much for taking this effort, taking this time to join in and learn about mental health and debunking some of our misconceptions about mental health as well.
Yeah.
I hope today's session is helpful to everyone.
Yep.
And if there's
Yes,
nothing, then we will, yeah.
yeah, I hope the same as well. I hope this was helpful. And yes, this video will be up on YouTube, on our YouTube channel. So it's gonna be accessible after that as well. So not to worry if you've missed any part of this live session. So once again, thank you so much for being here, and we are looking forward to see you again next week. All right.
Thank
Thank you. Have a
you.
great day, everyone.
Bye bye.